Hey, this is Dr. G with PromiseBlog.com. Today I want to talk to you about jaw pain. Inevitably, everybody has jaw pain at some point in their life. Either they are chronically having jaw pain, or they just wake up occasionally and their jaw is very stiff and they have some pain in that area. So these are my top recommendations for the most conservative treatment for jaw pain. The first thing I'm going to recommend to you is meditation or prayer right before you go to sleep for 10 to 15 minutes. It sounds a little new agey, it sounds a little weird. There are significant studies that back this up that show that people have incredible improvement just by doing this alone. Like 80% improvement just by doing prayer or meditation right before they go to sleep. I also recommend doing that with a pen and pencil, or pen and paper, or pencil and paper, so you can write down thoughts as they come into your mind and kind of clear your mind before you go into sleep. The other recommendation I have is for warm, moist heat. You can take 2 hot washcloths to where it's hot, but not going to burn you, and hold it up against your muscles like this. You're going to do that for 5 to 10 minutes, right before you go to sleep and right when you wake up in the morning. That also helps break the tension in the muscles and provides significant improvement and much pain relief in that area as well. The other thing I'm going to recommend is something called cold stretch. And it's the same kind of thing. You're going to do cold. You're going to do ice packs to the muscles. You're going to do about 5 minutes. And then what you're going to do is you're going to stretch your jaw out. You do that simply by opening very wide, and you're going to hold that as if you were stretching your muscles before you went for a run. So you're going to just do a stretch in that area while the muscles are cold, and that helps relieve some of the tension as well. And a lot of times you can do the cold stretch, do that for, hold it for 10, 20 seconds, relax, do it again, do that maybe in sets of 3, and then do the warm moist heat afterwards, and you should get significant improvement just by doing that alone. Now, if you want to move into the realm of something prescription oriented, what I highly recommend is a topical ketoprofen gel. And with this ketoprofen gel, it is prescription. However, instead of taking a pill, what you do is you actually rub it on the muscles. So you take a pea-sized amount, you rub it on the areas that are where there's the greatest amount of tension. It will help relieve that pain. That's another one of those things. It may sound a little foreign to you, may sound a little weird, or like it doesn't work. There's actually significant studies that back up that information. One in particular that I read recently was in the Journal of the Medical Association of Thailand, and it was a big study that was done for patients who suffered from knee arthrosis, pain in the knee. And what they did was they found a significant result of pain relief just by using that topical ketoprofen gel. One of the things that I use, it's kind of one of my little magic tricks that I pull from my back pocket occasionally too, is I have another gel that does have ketoprofen in it, but it also has ketoprofen, ketamine, cyclobenzaprine, and buprenorphine. And the combination of those 4 things put together in a topical sense gives tremendous pain relief to people. So I call that my pain cream in my office, and it's something that does have to be made by a special pharmacist who can perform something called compounding. So those are the big, main, most conservative treatments for pain relief in your jaw that you can do at home and in combination with a prescription. The other option, if that's not working, always recommend a night guard or an occlusal guard or a splint. It goes by several different names, but the concept is the same. Significant results with that. Typically 80 to 90% of the time people get pain relief with those as well. And then also a dentist may recommend taking a look at your bite, doing some other tests and different ways to analyze what's going on as well. So those are the big things. Warm moist heat before you go to bed, meditation or prayer, some kind of topical analgesia, and hopefully that helps. Thanks for visiting PromiseBlog.com. We'll see you again.